Let's see an NCLEX RN video with answers and explanation. A client with a renal failure is prescribed a low potassium diet. Which food choice would be best for this client? 1 cup beef broth, 1 baked potato with the skin, half cup raisins, 1 cup rice. 1 cup rice is considered a very low potassium food. All other foods are rich in potassium. An appropriate nursing intervention for the client with borderline personality disorder is observing the client for signs of depression or suicidal thinking, allowing the client to lead unit group sessions, restricting the client's activity to the assigned unit of care throughout hospitalization, allowing the client to select a primary caregiver. Clients with borderline personality frequently suffer from depression and suicidal thinking and should be assessed for risk of self-injury. Here if you see options B and D, they are incorrect choices because they allow the client too much control of the therapeutic environment. If you see option C, it is incorrect because the client's activities do not have to be restricted to the unit after the level of depression has been determined. Which of the following is an expected finding in the assessment of a client with bulimia nervosa? Extreme weight loss, presence of Lanago over body, erosion of tooth enamel, muscle wasting. So here bulimia nervosa, erosion of tooth enamel caused by frequent self-induced vomiting is an expected finding with bulimia nervosa. The first option extreme weight loss, second one presence of Lanago over body, and the last one muscle wasting. These are expected findings in a client with anorexia nervosa. Assuming that all have achieved normal cognitive and emotional development, which of the following children is at greatest risk for accidental poisoning? 1-year-old, 4-year-old, 8-year-old, 12-year-old. Because of the increased mobility, manual dexterity and curiosity, the 4-year-old is at greatest risk for accidental poisoning. Other accidental injuries in this particular age group includes being struck by a car, falls, burns and drowning. If you see a 1-year-old, they lack the developmental skill to be at risk for an accidental poisoning, and also 8-year and 12-year-old children. They are at lesser risk because they are aware of the dangers of accidental poisoning. Which term describes the play activity of the preschool age child? Cooperative, associative, parallel, solitary. Play of a preschool child. It's described as associative play. At this stage, children are more interested in playing with other children than they are with playing with toys. The child may talk to other children and exchange toys or play games without any rules. The first one, cooperative play, is a play for school age children. Parallel play is for toddlers and solitary play is a play for an infant. The nurse is ready to begin an exam on a 9-month-old infant who is sitting quietly on his mother's lap. Which should the nurse do first? Check the Babinski reflex, listen to the heart and lung sounds, palpate the abdomen, check tympanic membranes. When the infant is quiet, the nurse should begin the exam by listening to the heart and lungs. If the nurse elicits the Babinski reflex, palpate the abdomen or checks the tympanic membrane, the infant may cry and it may be difficult to adequately listen to the heart and lungs. In terms of cognitive development, a 3-year-old would be expected to think abstractly, use magical thinking, understand conservation of matter, see things from the perspective of others. So this is a 3-year-old. 3-year-old is expected to use magical thinking, such as believing that a toy bear is a real bear. The other 3 options are incorrect because abstract thinking, conservation of matter, and the ability to look at things from the perspective of others are cognitive abilities of an older child. Which of the following describes the language development of a 2-year-old? Doesn't understand yes and no, understand the meaning of all words, can combine 3 or 4 words, repeatedly ask why. So here a 2-year-old can combine 3 or 4 words. The first option and the second option, they are incorrect because the 2-year-old understands yes and no, but they does not understand the meaning of all words. And the last option is incorrect because seeking information and asking why is typical of a 3-year-old. A client who has been receiving urokinase for deep vein thrombosis is noted to have dark brown urine in the urine collection bag. Which action should the nurse take immediately? Prepare an injection of vitamin K, irrigate the urine catheter with 50 ml of normal saline, offer the client additional oral fluids, withhold the medication and notify the physician. So urokinase is a thrombolytic agent that is used in the treatment of deep vein thrombosis, pulmonary embolus or myocardial infarction. The presence of dark brown or rust colored urine suggests bleeding. The nurse should withhold the medication, call the doctor immediately and prepare to administer Amicar. The first option is incorrect because vitamin K is not the antidote for urokinase. If you see the options B and C, they are incorrect because they do not address the adverse problem of bleeding. Which of the following can occur with the frequent use of calcium-based antacids? Constipation, hyperperistalsis, delayed gastric emptying, diarrhea. So here the client taking calcium-based antacids will frequently develop constipation. The other 3 options are not associated with the use of calcium-based antacids. Which statement made by the student nurse indicates a need for further teaching regarding the administration of heparin? I will administer the medication 1 to 2 inches away from the umbilicus. I will not massage the injection site after administering the heparin. I will check the PTT before administering the heparin. I will need to gently aspirate when I give the heparin. The nurse should not aspirate when giving heparin. Therefore, this needs further teaching regarding heparin administration. The other 3 options indicate the student nurse understands the correct administration of heparin. To correctly assess the oxygen saturation level of an adult client, the pulse oximeter should not be placed on the finger, earlobe, extremity with non-invasive BP cuff, nose. To obtain a correct oxygen saturation reading using pulse oximeter, the probe should not be placed on the arm with a non-invasive BP cuff or intra-arterial line. Suitable sites are finger, earlobe or nose. While caring for an elderly patient with hypertension, the nurse notes the following vital signs: BP of 140/40, pulse 120, respiration 36. The nurse's initial action should be to report the findings to the physician, recheck the vital signs in 1 hour, Ask the patient if he is in pain. Compare the current vital signs with those on admission. A client is exhibiting a widened pulse pressure. So 140 and 40. So the pulse pressure is a bigger number. So it's widened, you can tell. So, and also there is tachycardia and also there is tachypnea. The first nursing action after obtaining these vital signs is to notify the physician for additional orders. All other options can be done after the physician is notified. Therefore, the first choice is to report the findings to the physician. The nurse is preparing a client with an axillopopliteal bypass graft for discharge. The client should be taught to avoid using a recliner to rest, resting in supine position, sitting in a straight chair, sleeping in right Sims position. The client with an axillopopliteal bypass graft should avoid activities that can occlude the femoral artery graft. Sitting in the straight chair and wearing tight clothes are prohibited for this reason. The other options are incorrect because resting in the supine position, resting in a recliner and sleeping in right Sims position, they all are allowed. Hope you understood this video. Thank you so much. Please do keep watching.